In this lecture, we are going to discuss influenza virus transmission, pathogenesis, clinical manifestations, and the lab diagnosis. So let's get started. If we look at the transmission, influenza virus transmits through the respiratory droplets from one person to another, and it mostly affects the respiratory tract. Respiratory tract can be either upper respiratory tract or lower respiratory tract. It is mostly active in the winter season, and if we discuss it according to the earth, we will see according to the hemisphere of the earth. In the northern hemisphere of the earth, you will see the winter season lies between the December to the February. But if we discuss the southern hemisphere, the winter season lies between the June to the August, and it mostly affects the older people. And if we look at the pathogenesis, so first of all, you will see here is the pharynx, that is our throat. Next part is the trachea, that is the windpipe. Next is the bronchi, and after that you will see the several branches, and ultimately it will go towards the bronchioles. And last part will lie in the alveoli. So here are basically the different components of the respiratory tract. When the virus, influenza virus, enters into the body through the respiratory droplets, it will affect the respiratory tract by binding to the epithelium of the respiratory tract. But important thing which you have to remember, in the respiratory tract you will see the presence of the mucus. Okay, and you will also see in the respiratory tract, you will see the two most important defense system. You will see the presence of the IgA antibodies that will protect it from the viruses, and you will also see the presence of the protease. Protease basically break the hemagglutinin of the influenza virus. Influenza virus has two most important proteins on its surface. First is the hemagglutinin and second is the neuraminidase. So this protease cleaves the hemagglutinin, and a IgA antibody also destroy the influenza virus. But if the influenza virus overcome these two defense systems, then it will affect the respiratory tract. Okay, and as a result you will see the inflammation in the respiratory tract. You can see the inflammation in the pharynx, trachea, bronchi. And if we go inside the lung, you can also see the pneumonia as well. So on the basis of the inflammations of the respiratory tract, we can say influenza virus causes pharyngo, laryngo, tracheo, bronchitis, inflammations of the pharynx, larynx, trachea, and the bronchi. So this is basically the pathogenesis of the influenza virus. If we look at the clinical manifestation, you will see the fever. You can also see the myalgia, muscles pain. This is mostly seen due to the increased level of the interleukin 6 and the 8 and tumor necrosis factor in the blood. As a result, you will see the muscle pain. You can also see the headache, sore throat. As we have discussed, you will see the inflammations of the pharynx. Next, you can also see the cough, vomiting, and diarrhea, basically rare manifestation. And you can also see the pneumonia. Pneumonia caused by the influenza. But you can also see the secondary pneumonia caused by Staphylococcus aureus and the Streptococcus pneumoniae. These can also cause the pneumonia secondary to the influenza virus. Influenza virus causes the pneumonia, but these bacteria can also get chance at the same time of the influenza virus attack. And if we look at the risk patients, so you can also see the children less than 5 years of age are more susceptible to the influenza virus attack, and greater than 65 years old people will also be attacked by the influenza virus more easily. In the pregnant women and immunocompromised patients, an obese patient can also be easily attacked by the influenza virus. Rye syndrome, that is the most important. When the children affected by the influenza virus, specifically or importantly influenza virus B, and if we give the aspirin to that children, and as a result you will see the two most important manifestation, encephalopathy and the liver degeneration, and as a result you will see the Rye syndrome. Okay, I repeat, if the children is affected by the influenza virus, specifically in influenza virus B, and if we give the aspirins to that children, you will see the two most important manifestation, encephalopathy and the liver degeneration, and you will check the liver degeneration with the help of the LFT, liver function test. These manifestations falls in the Rye syndrome. These Rye syndrome can also be happens in the chicken pox. Lab diagnosis, how we will detect the influenza virus. So most importantly, two types we detect clinically, influenza virus A and the influenza virus B. Influenza virus is more dangerous because influenza virus A causes pandemic. We can detect it through the PCR polymerase chain reaction. We can detect the RNA of the influenza virus because it's actually a RNA virus. You can also go toward the ELISA, enzyme linked immunosorbent assay. In this you will see the two category, two type of the test, flu OIA and the quick view influenza, in which we will detect the antigens of the virus through the antibodies by using antibodies. Stat flu, in this test we actually use the neuraminidase and we react the neuraminidase of the virus with the substrate, and as a result color changes happen in this test and we can detect the influenza virus in that case. We can also detect the antibodies in the serum of the patient, and one method for the detections of the antibodies is the heme inhibition test. This test is very much important. Normally when the virus add to the RBCs, you will see the heme agglutination. Agglutination process happens when the virus add in the red blood cells. Okay, but if we add the antibodies against the virus, then you will see there will be no heme agglutination. So that's why this test is called heme agglutination inhibition test. So this is all about the influenza virus. If you still have any question, you may ask in the comment section. Thank you so much.